Hello, and on this video we're going to be showing the effect of doing an ovate pontic when doing an anterior lower bridge. So this lady, she shows up in her office and she's been kind of pieced together with various dental procedures, implants, crowns, bridges, and so forth. And she has snapped off one of her lower front teeth, and you can tell from the x-ray she also has a radiolucency at the apex of one of the other front teeth. So the plan was made to go ahead and take out those two teeth and then make for her a 5-unit bridge. Everything that was it was cleaned up afterwards. You can see now the preps have built back those other teeth with composite, and then the depressions where the teeth used to be, you can tell they kind of have that dipped out area. Well, we're trying to make the final bridge prosthetic looks like it's emerging right out of the gum line, so we have to kind of train the gum tissue, or at least let it heal around a pontic. And unfortunately for this video, I did not get a photograph of the underside of either the temporary or the final prosthetic, but it did have kind of this egg shape or ovate pontic that kind of sat down slightly inside the extraction space. You know what, we brought her, first appointment, we actually did the preps, removed the teeth, put her in a temporary. Let her go for a few weeks. She came back, we took off the temporary, did a scan, put the temporary back on. Third visit is when she does arrive, when the final case is here. We take off the temporary and put the final prosthetic in place. On that last visit, when she was coming in to get the final prosthetic, this is how the temporary arrived in our office, with her wearing it now for several weeks, and you can tell that it just doesn't look like she's been taking really good care of it. It was much smoother than this photograph would make you think it was originally. We put it in, it was nice and glossy and smooth, but she shows up with plaque on it. Took off the temporary, and to our surprise, actually the gum tissue really wasn't all that bad. A little bit of redness there between those two prep teeth on the lower right, but notice the texture of the pontic space, or where the pontics are going to go. We have that nice depression in the gum tissue, so that when we seat the final bridge, that's what we have. We have, looks like a natural tooth coming right up out of the gums. That's what it looks like, a crowned tooth, but as we all know, that is a pontic tooth, and it's all connected together. If you look real closely, you can tell on the other teeth, the support teeth, the abutment teeth, those margins are super gingival, and the reason I do that is because her lip is going to be covering it anyway, so it's cosmetically, it's not that big of a deal, and I would like to just have the natural gum tissue, or have the gum tissue lay over the natural tooth instead of laying over, or at least having any kind of foreign material like porcelain down in that space. So it's very, very close, but not quite subgingival. And so when you consider where she started and where she ended, I think things look much better, and hopefully her hygiene will improve, and it will even last longer than some of these other teeth have. But when you're doing these anterior bridges, at least in our office, so what we like to do is try to create that pontic site so that the receptacle site of the gum tissue with the pontic is going to fit almost like an egg sitting in putty, so it looks as natural as possible. So do ovate pontic temporaries, polish them, make sure they're nice and smooth, and let your patients sit in them for several weeks before you do your final scan. Hopefully this has been helpful, and I look forward to your comments below. Thanks.